clear, Patrick, that there is definitely a strong case and a strong need for a globally distributed manufacturing capacity to make sure that all people are equally protected, because clearly when countries are facing a crisis, they are going to start by looking at protecting their own people at home. And perhaps you can argue, of course, whether we can blame them or not. But what is clear is that as African countries, we need to come up with our own solutions that brings health security for African people. So we need a new way, because the old solutions have not worked, and we need to change the way we are solving those problems. So which areas, Patrick, would you like to see Africa focus on in terms of COVID vaccine technologies that are present, that are available at the moment? Which platforms do you think would make the best launch pad for Africa to get started in terms of expanding its capabilities in local production of vaccines?
So, this is a question that generates an answer of, well, how long is a piece of string? Because there are so many options and so many possibilities.
Yes.
I think it really is going to be influenced by the opportunities that are on the table in a real way. So we can talk about theoretical or conceptual possibilities, and I think that's an important set of discussions and debates to have.
Yes.
Because if you look at the COVID-19 technology landscape, everybody talks about mRNA vaccine technology, because we know about the Pfizer vaccine and we know about the Moderna vaccine. People speak about the adeno-vectored viral vaccines, because we know about the Johnson & Johnson, AstraZeneca, etc. And then also, I think to a lesser extent, there's been focus and some visibility on inactivated vaccines because of the Sinovac vaccine. So these are killed vaccines.
Yes.
But others are working on other kinds of technologies. They're just not as advanced yet to be in the public eye. But they are the traditional technologies of what they call subunit vaccines. And without becoming too technical about it, basically these are the vaccines like hepatitis B, for example, is a subunit vaccine. We have VLP vaccines like human papilloma virus, the HPV vaccines, and there are many groups working on these different vaccine technologies. If the brief is to deliver a product from Africa for Africa as soon as possible, then it's an easy one to focus on. What you have to do is secure a partnership, a technology transfer partnership, that you have a willing company that's prepared to transfer the technology. You will have identified a recipient partner in Africa that has a good start in terms of the infrastructure, the skills required to absorb that technology, and a plan to perhaps expand and build out. You bring the two together, and then you create a project and you drive it forward. Now, there are lots of other moving parts that we need to focus on. But in trying to sort of zoom into your specific question about which technology should we focus on, I think that at this point in time, because the vaccines that are used under the EUAs are the Pfizer ones, the Moderna ones, the J&J, et cetera, that's where the fastest route to product lies. Now, this raises another set of questions about, but would they be willing to transfer this to an African player or a set of African players? Under what conditions would they consider doing that? If they were prepared to do that, how soon could we actually start that project? How soon will it take to deliver a product? And what would be required in terms of the resources and the mobilization of those resources to enable that?
Yes, and those are questions obviously you would need to have a conversation with a potential partner to be able to answer them. So what is clear, you mentioned technology transfer and the need to identify willing partners that can then, that are willing to pair up with African local manufacturers. It's been said that we can no longer rely on the goodwill of the technology provider to want to do it in order to do something good for Africa, that we have to be proactive by creating incentives that would actually be attractive to potential partners. So how are we changing the game? What is the thinking around the kind of incentives that might be attractive to the kind of potential partners we might be interested in seeing early on coming on board to help push this initiative forward?
So while one can address this question in a COVID-specific way, I think the principles apply more broadly to how one goes about building vaccine capacity on the continent or anywhere else for that matter in a sustainable way. So the first point at which to start, and the way I like to frame this is that when we talk about vaccine production capacity, we should talk about two sides of the same coin. The one is building it. What does it take to establish it? And the other side of the coin is what does it take to sustain it? Because establishing something and not being able to sustain it as an ongoing concern operationally is a waste of time, effort, and money. So one actually should start with the second point first, and that is what is the model for sustainability? Now, we all know that unless governments or some generous entity says, don't worry, I will pay for whatever you need, that takes care of the sustainability issue then, okay? But in the real world, it never happens that way. You need to create a business case, you need to create an investment case, and I am not a financial person or an expert in economics at all, but we all understand that in order to have a going concern as a business, and I'm not talking about making obscene profits now, I'm just talking about keeping the lights on, that you need someone to buy your product. And so this is a key issue for everyone to appreciate when we talk about this whole challenge of building vaccine production capacity on the continent, that the countries and the continent needs to come together and create an ecosystem which enables the investment of time, effort, and money in building this thing over time, which means that there needs to be a commitment to buying the product from wherever these capacities are going to be built on the continent. Now, this then immediately and unavoidably takes you to a big conundrum. And that is, of the 54 or so countries on the continent, around about 40 of those countries depend completely or partially on UNICEF for their supply of vaccines. And because they're getting these vaccines free of charge or at very discounted rates, there is very little power in the hands of those African countries to say, don't worry, Biovac Senegal or wherever we might decide to put up these COVID production centers. The decision to buy does not lie with them. The decision to buy lies with UNICEF or with Gavi, etc. And that's one of the things that needs to be discussed, debated, and reshaped to enable and incentivize this dispersion of capacity geographically across the world, and obviously from an African-centric perspective, particularly in Africa. So the first thing, in my opinion, would be to focus on the market and how this market could be shaped, what the procurement mechanisms ought to be in terms of ensuring that wherever there are investments towards building this capacity in Africa, that they can be enabled and sustained over time. And from there, the rest of the picture emerges. And I'd be happy to be guided by your questions in terms of exploring what the other technical focus areas might be.